Hello, I'm excited to be joining everyone to kick off tonight's Gatorade Performance Partner Expert Chat. I would like to give a special welcome to all of the members of the athletic training community who have tuned in from NATA's virtual conference. Throughout this conversation, we will be taking questions from the audience, so please drop your questions into the comment section. My name is Lindsay Baker, and I am a senior principal scientist with the Gatorade Sports Science Institute, leading our sports nutrition and hydration research program. Recently, our team collaborated with the Korey Stringer Institute on return to play guidance for activity, heat acclimatization, and hydration, which we will be talking more about this evening. I am pleased to be joined tonight by Becca Stearns from the Korey Stringer Institute and Jen Rheeling, who is an athletic trainer with the District of Columbia Public Schools, to discuss their research and considerations as sports ramp back up. To begin, Becca, can you share a bit about your background and why you thought it was important to spearhead this consensus statement around activity, heat acclimatization, and hydration safety as we return to sports?
Sure, yeah, and thank you, Lindsay. So I am the COO of the Korey Stringer Institute, which is housed at the University of Connecticut's Department of Kinesiology. And our mission really is to help improve performance, health, and safety policies as they relate to exercising individuals and active individuals at all levels. So really what we wanted to recognize with this document was that it is an extremely unique time right now, and that athletes are expecting to go back to activity, but in a pandemic scenario. So that's certainly unique. And we know that generally the summer and the preseason period are usually some of the riskiest times for athletes as it relates to catastrophic injury. So that in combination with some of the elements that the pandemic has introduced make us believe that this could be an even more risky time for athletes as they return. So what we wanted to do is to create a document that highlights these considerations and also brings in the tools and resources that we've used in the past that we know help to mitigate these risks. Some of those largely being hydration breaks, hydration considerations, heat acclimatization, and weather modifications to practices and games based on how extreme the environment is. So these are tools that we already have that we think will be even more essential as athletes return right now. And so we wanted to create something that highlighted those and also provided some concrete recommendations on how to implement these during this time.
Thank you, Becca. And, as a co-author of the guidelines, I wanted to commend you for your leadership in bringing all of the organizations and all of the experts together to produce this consensus statement and to do so in such an efficient and effective manner. So great job.
Thank you.
You're welcome. Next up, Jen, please tell us about your background and why you got involved as a writer of this consensus statement.
I am a 29-year veteran of the Washington District of Columbia Public School System, and I am currently the sitting chair for the National Athletic Trainers Association Secondary School Athletic Trainers Committee, and it's in that role that I became involved with Korey Stringer. I have worked with Becca and the Korey Stringer Institute on other health and safety initiatives, and they're always very supportive of athletic trainers and our initiatives to keep our patients safe. So collaborating with them was a no-brainer.
Thank you, Jen. Before we dive in, a friendly reminder to the audience that you can submit questions through the comment section. So the first question I want to start with is something that is top of mind right now, given that we are now in the middle of the summer. It's been really hot and in many places also very humid. So as athletes are transitioning back to sports and exercise, we are faced with challenges around heat safety and hydration, as you mentioned, Becca, in addition to this novel sort of situation or challenge of COVID-related concerns. So Becca, starting with you, what are some key safety guidelines to follow when keeping athletes hydrated during the current conditions?
Yeah, so hydration is one of those really important things that can help mitigate, performance and also improve, health and safety on the field. So generally, it's something we are always wanting to consider when athletes are participating in hot, humid environments. And again, even more so now that we have athletes returning into this scenario following a pandemic or even still during a pandemic. So it is really important to make sure that we're implementing individualized hydration strategies and allowing athletes to have those opportunities to rehydrate. And I realize that there's also the added layer of doing this in a safe manner and trying not to spread a potential virus around to your other teammates. So we're really asking a lot of the teams, because we're asking them to balance this need for hydration breaks, but also balancing the health and safety of those athletes. So what we recommend in the document is that the ideal scenario would be if all the athletes could have their own squeeze bottles, and during hydration breaks that they're able to access those, and that there is a designated individual who can be responsible for refilling those bottles, which will limit the number of people that are coming into contact with those. So I realize that that might not be realistic for all scenarios, but the closer you can get to that, the safer things will be. And so it is important to strive for the solution that you can do that is as close to that as possible.
Thank you, Becca. Jen, anything to add?
Well, I know a lot of athletic trainers are stressing out about that, and you just have to keep in mind that you can control what you can control, and now is a good time to really partner with the rest of the people on your campus to help out. So it doesn't just sit on your shoulders. Make sure you're involving everybody.
Great point. So Jen, the next question I'm going to direct first to you. What types of evaluations would you recommend before allowing athletes to return to participation?
Well, the pre-participation physical exam is always critical. We understand that some athletes may have issues accessing their provider at this time. So it may take maybe extending the expiration dates on their prior physicals from last year. If you don't have one on file for an athlete, they definitely need one. If you have athletes with pre-existing conditions that may cause them greater concern for participation, then they need to be evaluated as well. In particular, autoimmune conditions, anything related to cardiac conditions, all those are going to be, we're going to need to know that they're safe to participate with the increased concerns that we have circling around COVID. So I also know practically we also test for their hydration levels prior to participation, probably a little more critical right now because we're not really sure how any of this is going to affect them. So we always do the refractometry and make sure they're hydrated before we start.
Great. And Becca, this next question, I'll go to you first. What do you anticipate being the biggest change as it relates to keeping our athletes and performance teams safe as they return to play, with physical distancing considerations top of mind?
I think one of the biggest things, especially that we try to emphasize in this document, is that there might be, situations where we resume activity and then we have to halt it suddenly. And then because of that break, we have to have those extra considerations of how do we resume activity. There could be potentially just a couple weeks, or it could be months before athletes return to activity. So having a plan in place that specifically addresses how you're going to resume activity is really important. And in the document, we really recommend anything longer than 2 weeks would basically call for a return to baseline and starting basically at point zero again. So that's one of the biggest things athletes can expect as they return. And certainly, we're still learning a lot about this virus. And so we don't know what extra, risk factors may present themselves for athletes that do contract the virus and then try to return to play. So those are all very important things to consider and stay on top of as things evolve.
Sure. Anything to add, Jen?
Patience is going to be a huge benefit right now. We don't really know all that we're dealing with and what's going to come at us. So to be flexible and have the ability to pivot as things change, and to just understand that we're going down this road that hasn't been traveled before, and so things are going to have to change, and we just have to be ready for it.
Yeah, I agree. Patience and flexibility are very important at this time. So before we go to the next question, just another reminder to the audience that throughout our entire discussion, please go ahead and submit any questions that you have and engage with other attendees through the comment section. So Jen, starting with you, we talked about PPEs a little bit before, but can you remind us all, really nail down the point of why establishing a PPE is so important?
The initial PPE is critical to athletic trainers. It lets us know about pre-existing conditions that we need to be aware of, any mitigating factors that we need to offer to those student athletes to help keep them safe and to provide better care, quicker care when it's necessary, and provide accommodations to allow them to participate safely. So the PPE is just, it's the bottom line of the start for any student athlete. So it gives us all the information that we need, and it also helps establish a team of care for each individual athlete. So.
Right. Becca, anything to add?
Yeah, I would completely agree with what Jen just said. The value of the PPE can't be understated in this scenario. And so I think it's really important that the schools, the high schools and the colleges really make sure they're able to have a plan in place to make sure the athletes are able to access that and get that done before they return.
Thank you. So Jen, a question that's coming in, what do you recommend sports health professionals include in their education plan with athletes? How can we educate our athletes and the other practitioners around us?
In terms of COVID, I believe that a lot of our age group thinks that they're not really affected by COVID to the same degree that others are. And so really letting them know that, first of all, they can contract the disease, they can become sick from the disease, but the big thing is that they're carriers and that they may be risk factors to the people they live with or the people they love, and that any efforts that we make on campus to mitigate any cross-contamination, they need to carry that across the rest of their days. If we've with them for 2 hours, there's 22 hours that they need to keep that up every day, so they don't eradicate our efforts. And the better we adhere to all of the scientific recommendations, then the quicker we'll get back to something approaching normal.
Great points. Becca, anything to add for that question?
Yeah, and I think getting the buy-in from the athletes is just huge, right? So if you can really kind of be very transparent and lay out, the why and the hows, then I think you're going to get a lot more buy-in from the athletes, and that's really going to be key to keeping everybody healthy and safe and being able to return. Yeah.
Great. Thanks, Becca and Jen, for the great answers there. So going back to the topic of hydration, we have a couple of questions coming in from the audience who are interested in this topic. So Becca, staying with you, a question from Tyrone, who asks, can you speak to the appropriate lead time for hydration? We always hear about hydrating the day before an event, but what does the data support on lead time?
Yeah, and that's a great question. I mean, ultimately, maintaining a healthy level of hydration throughout the day, and then certainly during intense periods of exercise in the hot environment are important. There's been research evidence to show that during the day it's important and can impact your cognitive functioning as well, and many other important physiological factors. So it's not just important to consider hydration something that's only relevant during that acute exercise period, but really, during the day, so you can function at your best, and then also just prepping your body for when you are ready to go into an exercise session so that it is ready. So that's a tough answer, I think. I think that hydration is going to be important throughout the day. But ultimately, yes, you want to be cognizant leading into an event. You can influence your hydration status relatively acutely. It will certainly depend on how well you are or how well you've hydrated up to that certain point. So you can only make up so much so fast. But if you maintain a relatively good level of hydration, you don't have to worry about it. And I think that's the best way to go.
Agree. Yeah, so, we know that in working with athletes, a lot of them only think about the importance of hydration sort of in that moment of when they're already hot and, they can see themselves physically sweating. And at that point, it might be a little bit too late, right? When they're already active and already dehydrated. So, really pressing upon the athletes the importance of that everyday hydration, hydrating throughout the day and showing up to that practice appropriately hydrated is really important. So another question related to hydration and in particular keeping the squeeze bottles clean. Erica from our audience asked, are there preferred disinfecting solutions for squeeze bottles and coolers to help combat the spread of COVID? Jen, do you want to try to tackle that question?
So our first line of defense is to have each individual student athlete have their own squeeze bottle so that we can mitigate as much transfer as possible and have as little touching as possible. Secondly, like Becca mentioned earlier, hopefully have someone that can be dedicated to refilling those bottles, and so that only that one person is touching anything, the cooler or anything that you're using to refill, so that multiple hands aren't touching that. So same thing. Some of the recommendations that have been put out aren't necessarily viable for every setting or for every institution, and you're just going to have to do the best you can with what you've got and mitigate as much as you possibly can. So PPE, in this case, your personal protective equipment, not your pre-participation exam, those are going to be critical. Training someone to work with you to do that. It's probably not the athletic trainer's best use of their time to stand at a hydration station throughout a whole practice just to fill up the squeeze bottles, but somebody does need to be available to do that. And, again, just reduce the number of touches and number of hands everything goes through before it reaches the athlete.
Yeah, it makes a lot of sense. So another topic that was covered in the consensus statement was heat acclimatization. So Becca, another question coming in from the audience is, what tips do you have for helping athletes with heat acclimatization as they return from physical distancing?
Yeah, great question. And probably one of the most powerful tools we have in combating the heat and exercise in the heat. So I love the process. I think it's really interesting and powerful because you have a lot of changes that occur throughout the body that really make your heat tolerance increase for exercise. So the biggest thing with heat acclimatization is it does take about 10 to 14 days of consistent exercise in the heat and exposures. So you have to be a little patient, which I know can be tough. But after about that period, most of those adaptations will have occurred. So you'll have all the benefits that are associated with heat acclimatization by that point. So 2 weeks is really something that we do support and try to emphasize because really that's when you're going to see the benefits. So try to follow those guidelines. The NATA had put out those heat acclimatization guidelines back in 2009. They're still very relevant today. And so try to follow those as best you can, and you will definitely reap the benefits if you do.
Yeah, and in terms of that timing, it's really critical that enough time is allowed for heat acclimatization to be complete, right? So what would you, would you make recommendations in terms of the schedule and trying to avoid a situation where the start of a season might be scheduled too soon and not allow enough time for full heat acclimatization. So can you just speak a little bit more about the timing and schedules in terms of, do we need to make changes in terms of when that regular season starts, if at all possible?
Yeah, and I mean, that's a great practical component to all of this, right? So when I say 2 weeks, that's really the timing that it takes for the full benefits to take place. But really in terms of the impact on the schedule, the first 5 days is where you're going to see the most modifications occur. And after that, it's really just about gaining the exposure. So in the first 5 days, things are phased in gradually. Things like the amount of practice, the amount of equipment that can be worn, the amount of contact that happens, and the total volume of practice that can happen. And then also when double sessions can begin. But after you hit that 5 or 6 day mark, you're really just going to continue with the season as you would without any sort of limitations. But you do need to be cognizant that you're going to take another week to 10 days to get those full benefits. So you can continue with exercise as normal, but just be aware that you're not going to be fully prepared in terms of heat acclimatization for the heat until 2 weeks pass. So ideally, in this time, we would, ask if there's any way that a schedule can allow for greater contact prior to any games or any intense practices. Then that's recommended, because we anticipate that the players and the athletes are going to need a greater amount of time and a gradual progression leading up to those games and sessions, given the climate that we're in right now. So if you can get more time, take it. And if you have to boil it down, just make sure that, you're getting in the minimum amount of time that's put forth by the best practice recommendations.
Yeah, thank you for all those clarifications on the timing. So again, another reminder to the audience that you can submit any questions that you have in the comment section. So the next question we have is sort of building on the hydration conversation. What about having one designated person to fill cups versus individual squeeze bottles? Any concern with that particular model? This question is coming from Sarah, and Jen, I'd like to direct this question to you.
No, not really. You may have a concern with the trash generated or the recycling needs for cups or whatever, but that's an acceptable solution as long as, again, the person filling those cups is taking all necessary precautions to not cross-contaminate.
And another build on the hydration question and the vessel that's used, are water cal systems a safe way to limit contact for water refills? Becca, what are your thoughts?
Water cal systems in terms of the kind of this. I want to make sure. I'm not 100% sure, but I assume it's where it's a situation where there's access to the water.
So there are some water cows. Yeah, some water cows the kids have to touch. Like I have one where they have to pick it up and turn a lever to utilize it. So that one's probably not a best practice. We wouldn't necessarily want them to do that. So, but if it's a long system where water is just continually running, or there's one turn on, turn off spot, and it's running, and the kids don't have to touch anything, the athletes don't have to touch anything, then that may be workable. So
yeah, I would just make sure too, if you're going to use a system like that, make sure that when the athletes drink, none of the water ever drips back on to the unit itself. So have it at an angle of some sort, or make them stand so far back where they can still reach it, but not over it at all. So, yep.
Thank you both for answering that question. The next topic we want to cover here is about risk profiles. So Jennifer, starting with you, are there certain athletes at greater risk for things like dehydration and injury? So that's a two-part question. First, let's talk about musculoskeletal injuries. Are certain athletes at greater risk for those types of injuries?
Not necessarily musculoskeletal, but we're always on alert for student athletes that have asthma or any kind of respiratory concerns, sickle cell trait. We know that can contribute to dehydration, and that those athletes often need a longer ramp time to full activity. So any of those in this situation, we're not really fully aware yet of all the cardiac concerns, all the ways that this could affect our student athletes. And so again, taking a longer lead time, paying closer attention than you may have in the past, definitely identifying each of those student athletes with concerning pre-existing conditions, all that's going to need a little extra attention in these times. So, because we're just not really sure yet all the ways which this could affect or sneak up. Like if a kid had COVID over the summer, and we don't know that if there's not going to be any long-term respiratory effects from that. So we definitely need to know to keep an eye out for all those student athletes.
Right, and similar question for you, Becca, but more so focused on the heat injuries, heat-related illness or injuries at this time. Are there certain athletes at a greater risk?
Yes. So in general, we know that there are certain athletes that just are generally more at risk for a heat illness, and those are typically our football players tend to be those that we see a lot of heat illness in, and specifically linemen when it comes to heat stroke. So football players are unique in that they're very large individuals. They wear a lot of equipment. They have very intense exercise sessions. They get no reprieve if the sun is out. They're in a wide open field. So there's a lot of factors that go into making them also very risky. But we see it in all different sports. So it's certainly possible in other sports as well. And the thing in this climate that would really add risk to those individuals is the fact that we don't know what kind of activity the students or the athletes have had in the last few months. And so it could be dramatically different than what they're used to. So the incoming athletes to these practice sessions and coaches could be completely different than what they've ever dealt with before. And so you could have very under-conditioned athletes who just did not have the ability or opportunity to exercise. And so they might be, lower in fitness than normal. And you might have some athletes that might not be at risk because they were able to work out and exercise. And so, so you have that big spectrum in terms of what athletes could come in. And so you really need to take the time to ramp up the exercise sessions to get everybody onto the same page and onto the same fitness level. And we know that will really help to improve the health and safety of the athletes. Yeah.
Now is a good time to look at your less fit athletes as they come in and use them as your benchmark rather than using your highly trained athletes. Now's a good time to bring everybody up to one level instead of starting at a level and trying to pull everybody to catch up. So, excellent
point. The next question is coming in from Veronica, and Jen, I'll direct this one to you. If student athletes are being screened prior to entering school for the day, is there a need to perform yet another screen prior to practice? For example, other screening measures like temperature checks?
So scientifically, I don't know that I have the answer to that. I have heard some professionals say that no, there's no reason. They were screened once and, you're good through the day. I would say anecdotally, I'd say a lot can change in 7 hours. I have gotten up in the morning and felt fine. And then by mid-afternoon, really wished I hadn't come into work that day. So it's more of a logistical issue, to have a rush of student athletes come in at the end of a school day, and how are you going to manage that? I wouldn't say it's a bad idea. I don't know just how relevant, it's going to be or where that's going to pan out in the long run.
Becca, anything to add?
Yeah, I think Jen made some great points, and we've also gotten a lot of questions about, what screening protocols do we need to have in place? Is it just a questionnaire or is it temperature monitoring? And, so there is some good guidance in terms of the questionnaires and things you might want to consider taking within our document as well. So that could be helpful, but I agree, it certainly does not hurt to be extra precautious and take another screening before practice. Certainly, if the goal here is to limit the spread and keep the practices going, I think that's a smart move. Yeah.
Thank you. Thank you both. So the next question from David, he asks, should athletic trainers be in full PPEs such as masks, gloves, and gowns for each athlete encounter? Jen?
Again, so there's varying guidance on this as well. I would say it depends on your personal risk level, how exposed you feel. If you have any pre-existing conditions, that's one thing in this whole whole climate that is a concern. We know that it's in the best interest for our student athletes mentally and emotionally to get them back to some semblance of normality and peer interaction. But we need to temper that with being safe, and there have to be adults involved in that. And so, if you're in a high risk category, or if you feel like it's the better thing for your own safety, then definitely. I'm not sure how practical that is. And in the middle of a hot August, to be in full PPE, you might end up with a heat exhausted athletic trainer, and we definitely don't want that either. So I'd say finding a right balance for you to be able to complete your responsibilities and your duties for your student athletes, but also maintain your own personal health as well.
Yeah, great point. So the next question coming in from Eric is a great question, coming back to the temperature checks. And he asked, with these temperature checks becoming standard minimum for athlete participation, how much does something like a warm up, if they do it on their own before they come in, or before they get checked, or temperature, environmental temperature of the day, or equipment that they might be wearing, how do these factors, factor into allowing play if temperatures are elevated?
Yeah, so it's a very good question, and ideally you would catch them before they do any sort of activity, and you want to do it in a controlled environment. So ideally you're not outside either, because that could change skin dynamics, and so ideally you want to be as controlled as possible if you can. I know we're talking ideal situations, a lot of these, but we also have to be very realistic. So what you can do in these scenarios, so so I would try to catch them before they do any sort of warm up, and before they head out if possible. And athletes are smart. So if you're doing oral temps, make sure they, are not drinking water before that. There's ways around a lot of these things. So athletes will get tricky if they need to, if they're really desperate and they want to play. So just be cognizant of that as well. You can do some things that will alter some of the reading. So just be careful. But again, just try to put it in the most controlled, calm environment possible so that you can get an accurate reading.
Great. Jen, anything to add there?
Same thing. A lot of jurisdictions are not allowing building access at this time. So to be able to find somewhere where you are in a controlled environment is going to be tough. And I know that some athletic trainers are relying on a self-report system that the athletes should take their temperature at home before they leave and come. Again, we're probably a little concerned with the honesty on those answers, because we know they want to participate and they don't want to be sent home, and whatever's going to come from that. If you send a student athlete home, they're probably going to have to go get tested before you allow them back on campus, or at least go see a physician. And so that's going to be time away from the activity that they're trying to participate in. So it's just going to be a lot of balancing. And, I'm not sure in that environment, if you have to be outside, then probably the touchless thermometers aren't going to be your best option. So.
Great, thank you. And the next question coming in from Nadine, who is in Florida, has a question about methods to try to keep athletes cool. So Becca, I will direct this question to you. And specifically, the question is, have you investigated how having shade for players who are not involved in drills, how does that impact body temperature? Does it significantly decrease their body temperature? The audience member says they've been preaching to the coaches to have a pop-up tent on the field for years. So, what are your thoughts on, is that an effective method to keep athletes cool?
Great question. And I think it determines on how you want to approach this, really, or how you want to justify it. So, in terms of the thermal load the athletes are going to experience, yes, being in shade is less stressful than being in the sun. But when it comes to cooling, and if you're trying to have an effective cooling protocol in between drills, then shade's probably going to feel really nice, but it's not going to be a very effective method for cooling athletes, especially if you only have a minute or two. So from a cooling perspective, I'm not going to buy that argument. So really, the cooling in between drills perspective really comes down to, or any sort of cooling just comes down to how much surface area you can get and how cold you can get that surface or that skin, exposed to. So ideally, whole body water dousing is going to give you the fastest cooling possible. But of course, that's not going to be realistic in between drills. So how much of the skin can you get exposed to cold water probably is going to give you the fastest cooling. So there's ways to do that. But there's also, many other tools that we talked about that are really effective at helping to mitigate the heat stress. And those go back to hydration strategies and heat acclimatization and having appropriate work to rest ratios.
Great. Thank you, Becca. Next question is for you, Jen. How can sports performance teams prepare for possible interruptions or timing adjustments to their normal seasons?
Education is key. Warning your student athletes that may come, stressing to them the more they adhere to protocols, then maybe the less likely that is to happen. But I would also say being prepared for that. If you're mid-season and you have to take a break, already have plans in place. This spring, it caught us off guard, and we were at work one day and we weren't the next. We were at school one day and we weren't the next. And so now we know that likelihood exists. So already have plans in place. Already say, if this happens, make this part of not necessarily an emergency action plan, but part of your action plan. If this happens and we have to go virtual, this is what we're going to do. So there's no loss, and that you can maintain, contact with your student athletes and keep up some level of something that they can do not on site.
Becca, any points to add for that question?
Yeah, I think always thinking through the possibilities is really helpful, because then you are always going to have an idea of what you need to do if any of those possibilities come to fruition. So having a plan in place, playing out all the different options and things that could happen is really important to making sure you have a plan and you're prepared, definitely.
Right. And Becca, staying with you, the next question is, how do the recommendations differ between high school and collegiate athletes?
Yes, so the document that we released really did try to focus on high school and collegiate athletes. And we do realize that a lot of the recommendations are easily shared between the two cohorts, but certainly there are also some unique aspects to both of them. And that really comes back to things related to resources and responsibilities, I would say. So from a resources standpoint, the college athletes probably have easier access to certain items. Like we know that most college teams are going to have access to an athletic trainer. We also know that they're probably going to have a dedicated team physician. So getting a PPE might not be as challenging for some of those collegiate athletes as some of these high school athletes. So we play out some of those scenarios where you might have to have some flexibility and some creative options to get a PPE for a high school athlete, or what kind of PPE you're going to accept. And responsibilities we talk about in terms of there's going to be a lot more policies and procedures that have to be in place, and who's going to implement those, who has to review them, who has to educate on all of those. So there's different individuals involved at the high school and college levels. And so we really try to speak to who should be in charge, who can take on some of these responsibilities, how they can be disseminated, and how you can really have an effective strategy in this climate. Yeah.
Thank you, Becca. Jen, anything to add to that?
Same. I would say a lot of it's personnel and resources, and there are going to be some smaller colleges that have the same issues that some high school athletic programs have, but there are also some high schools that are very resource laden, and so that's going to be a big part of this. What can you afford? What can you provide? How many athletic trainers are on staff? I can only do but so much, and I've warned my coaches. The lead time, say we go back to school, the lead time after school and before practices start is going to have to increase, because I'm not going to be able to allow 30 kids in my room at one time, and we're going to have to space that out. So A lot of it just comes down to resources and responsibility of the kids. I also know, if you're on campus for college, it might be a little easier to control their movement. But high school students, they all go home to different situations. And so that may give us a little greater risk profile too.
Thanks, Jen. And staying with you, Jen, the next question is from Tanya. Is there a concern that some of these athletes won't have access to get tested, or don't have parents perhaps willing to take them, or not possible because of financial barriers perhaps?
Absolutely, and I think that's going to be a big opportunity to work with your Department of Health and your school-based medical personnel, school nurses, health centers. Like I said, working with the Department of Health to see if they can provide some resources, if they can intervene or help in any way. Hopefully, like I said, you have a school nurse that can help on the school level. You don't want a situation where you have turned somebody away from practicing, but yet school is letting them come into the building. And so it's going to be a team approach, and, to have some sort of a COVID team set up so there's good communication between all involved parties is going to be key.
Becca, anything to add there?
Yeah, so one key thing I do just want to let all the listeners, viewers know about is that as part of one of the resources that we released with this document, we did create a policy and procedure template. I have to give credit to Dr. Sam Scarnio-Miller for that. So we have that template, and it's freely accessible, open to everybody, and it outlines all the policies and procedures we're talking about and some additional items that are contained in the document. So we did try to create something that is not only a resource, but also provides links and direction so that you can find other resources to some of the information that may not be in this document, but is certainly relevant to returning to activity in the COVID era.
Great, thank you. Mm-hmm. Next question, Jen, we'll go back to you. Is there anything that you could ask of the athletes to help with new protocols that are in place now that they have to follow? What can the athletes do to help?
So, and that goes back to education. The more they understand why we're doing what we're doing or asking them to do, the better their buy-in will be. And I heard of a state, I believe it was Ohio, they're asking their student athletes to tweet out with the hashtag, I want my season, to help encourage people in the public to, follow protocols, and so that they can mitigate the spread in their community and give them the best opportunity to resuming some sort of level of athletics. So the more we do, the more ownership we give our student athletes of it, the more they understand the why behind it, then the more likely they are to buy in and cooperate with us.
Right. And Becca, next question is for you. How can programs effectively move away from self-serve settings?
So it's a good question. In terms of self-serve settings, can you extrapolate on that a little bit more? Do you know in the context that they were asking the question?
I don't have more context, but is it perhaps for collegiate programs that might have a training table or something like that? I'm not certain.
Okay, so maybe speaking to items that have traditionally been things that we've relied upon the athlete to do. Yeah. Okay. So I think, again, this all goes back to getting the buy-in from the athletes at the very beginning, right? So we're going to have new protocols in place, and we're going to have additional asks of everybody involved. And so I think that, again, making sure that we're educating all of those involved, including not just the athletes, but the coaches, the administrators, additional, providers that may be involved in terms of the school nurse and team physicians, so that everybody can be on the same page and have that buy-in, and really just supporting everybody as they're trying to implement these new policies and procedures.
Great, thank you, Becca. And the next question is for you, Jen. Coming from Veronica, she says, I've been seeing recommendations that common spaces like locker room should not be accessible by student athletes. So can you share your thoughts on managing the athletic training room for student athletes?
That is going to look different depending on the time. If school's not in session, you're largely going to be outside with your student athletes, and it's going to look like it normally does when you're on the sideline. If school's in session and the kids are coming to you after already being in the building and you do have access to your facilities, then again, patience and a lot of forethought and planning, perhaps appointments, and again, really letting the kids understand that they can't rush into your facility at one time after school any longer, that we're going to have to do this in a planned for thoughtful manner. So, it's just one of those things now that we're just going to have to make adjustments and make it work to the best of our ability. And again, communication with your coaches and your athletes and your parents, that everything just isn't going to look the same for a while. And we need to adjust to what our new normal is.
And Becca, any final points there or additional points there?
Yeah, Jen's doing great. I completely agree with all of that. This is a new normal for sure. And so I think it's going to take that team effort to get there for sure.
Yeah. Great. Well, thank you both for answering all of these questions. We have just a few minutes left, so unfortunately, that is all the time we're going to have for Q&A today. I want to thank you so much, Becca and Jen, for joining us. This discussion has been fantastic, and we've learned so much about what guidelines should look like as we return to sports. So I want to let the audience know to please check out the guidance document for high school and collegiate athletic programs, which we've posted in the comments section below, developed by KSI and GSSI, for more information as you get back to play. Becca, Jen, any final remarks for our audience?
So I guess I'll go first. I just want to remind everybody to kind of remember that we're in an incredibly unique period, and we've really never faced this before. And so we need to make sure that we are making some modifications to account for these things, but we already have the tools in place to do a lot of those, which include the things we talked about today. So individualized hydration strategies, heat acclimatization, and weather modifications. And so all of those are tools that we already have that we just need to be cognizant and aware of, and really make sure that we're implementing safely in consideration of the new environment we're in. But then I think if we can do that, then we can be successful moving forward.
And I would just like to say to my fellow athletic trainers out there, we are used to juggling 1,000 tasks and being the master of many domains. And this does not have to all rest on your shoulders. This is a team approach if there ever was the need for one, and don't shoulder the whole load yourself. And now is a good time to reach out and get all the support and help you can from your administration, your coaching staff, anybody that you can to help you with this. So there's no way we can cover all these bases by ourselves. And so make sure you're leaning on your support system.
Excellent. Thanks again to both of our panelists. If you have additional questions, we also encourage you to check out our Gatorade Performance Partner for a series of resources related to helping your teams and athletes return to play. Before we wrap things up, we wanted to encourage everyone to join Gatorade Performance Partner, the first multidisciplinary community of sports performance professionals. With this program, you'll get access to exclusive benefits like complimentary CEUs, science-backed resources, and opportunities to discover all the latest that Gatorade has to offer. And be sure to follow Gatorade Performance Partner on Facebook, Twitter, and LinkedIn so you don't miss out on any exciting new updates. With that, we hope you enjoyed this Gatorade Performance Partner Expert Chat, and we look forward to staying in touch with you. Good night, all. Thank you.